So we have multiple brands, and amongst them we are starting this diabetic food and ulcer clinic as the demand in India is too much. But if I ask, like in Surat, how many centers you know they are dedicated to diabetes? Maybe no. In Baroda, morning one of my relative called and I just asked, he is doctor there in Baroda. Just name me one clinic in dedicated to diabetes. No one was there. So there is a huge opportunity about this, and that's why we have started. What we have done, we'll discuss today. I'll be discussing about what diabetes does to food and also how we are tackling it. Otherwise, there are so many non-medical persons also are here, so that all medical terms may be very difficult. So I can start about the presentation. So diabetic food, हम सबको पता है कि डायबिटीज आंखों पे असर करता है, किडनी पे असर करता है, हार्ट पे असर करता है, लेकिन किसी को डिस्कस नहीं किया जाता कि डायबिटीज अपने पैरों को भी असर करता है. तो डायबिटिक फूड इज एन area where the food complications due to diabetes that are tackled. Mainly there are two problems, maybe three problems. First is reduced sensation. मैं किसी को पूछूं पेन अच्छा होता है, जिसको लगता है पेन अच्छा है वो हाथ ऊपर कर दे. दो तीन मे बी डॉक्टर्स only. Pain is a protective sensation for our God gift. That God gift is taken care by our food, but in diabetics it has gone. उनके पैर senseless हो जाते हैं, and then they have minor injuries, but they don't know. They have fractures, but they don't know, and that's why repeated injuries will start. The other thing is less vascularity due to sugar deposition in their blood vessels. I hope all are clear with English also. So, due to the deposition of sugar and calcium in their blood vessels, the blood flow significantly reduces. So they don't get fresh oxygen, they don't get antibiotics what we give, they don't get the chemotactic factors and immunity factors to their wounds, so that the repair is less. And last is neuropathy, means their nerves also are gone due to sugar deposition. So nerves also are gone. Then there are three types of nerves. This is just to make you understand what diabetic food is. My lecture is still going on, but I'll be explaining this. One is motor nerves, we call it positive nerves, which takes the brain signals to muscles that you need to move. Other is negative wire called sensory, means the sensation from down to brain. And last is autonomic, which is not under our control, that takes care of our heart rate, our perspiration, our sweat. So everything has gone. So their foot are deformed. So deformity, sensation absent, with less vascularity. These are the three main reasons why diabetic patients get trauma, ulcer, infection, and then non-healing wounds. So whatever wounds are there on their feet are not just on their feet. They are also coming to their mind. There is a fear, continuous fear of whether I will be able to walk, whether my life will become normal again. They have continuous thinking that can I become dependent on other, or can I earn for my family or not? And lastly, it can also cause systemic damage, limb loss and life loss also sometimes. So talking about the burden of diabetes, till I have talked to you, 3 to 4 patients might have lost their limb due to diabetes in whole world. So every 30 seconds, और ये कहानी नहीं है, ये proven data, scientific journal में presented data है. every 30 seconds, one of us loses their limb due to diabetes in whole world. And 68% of patients, they spend exorbitantly, but still don't reach where they need to reach. And then the result is poor. India has 1 lakh amputation per year due to diabetes. So this is the number 1 cause after trauma. एक्सीडेंट में जिनके पैर कटते हैं उसके बाद सबसे बड़ा रीजन है डायबिटीज में पैर कटना, जबकि 85% of them are preventable if we deal with them early, if we give them proper care, if we do treatment in early stages. So there Elegance Diabetic Foot and Ulcer Clinic works. So where the system fails the patient, it's not patient's fault, it's system's fault. That no dedicated diabetic foot clinics are there. We have huge population. More than 70 million Indians have diabetes and they both have 2 feet. Look at 140 million foot are there to take care. But still, how many centers you know, they are dedicated. Even bigger hospital like in Surat, if we talk, Mahavir, Global, Kiran, any of them have diabetic department? No. So this is totally neglected and this is a very good opportunity for those who want to treat it. What happens is patient visits a general doctor or maybe surgeon sometimes, but they are not that trained to diagnose and the risk of the diabetes to find out early and treat them. There are fragmented cases. Sometimes patient will go to general surgeon, sometimes it will go to orthopedic surgeon, sometimes they go to vascular surgeon, sometimes they even come to plastic surgeon. But there is not one umbrella under which everything can be managed. And that's why it's a critical delay. Patients come to us at the stage 3 and 4 where we can't help them. We need to amputate their toes, we need to amputate their limbs. But stage 1 and 2 are the main stages where we can intervene, we can make difference in life of patients and thereby our profession to make difference in the society. We say that 1 limb saved is 1 family saved. And what happens? India, the average income is 500 rupees per day. And expense, we all doctors know, 1 dressing will cost 1000 rupees. Transport, medicine, material cost. The person who is not going to their job, there is a loss. Again, the person who is accompanying, there is a loss. So it's a huge burden on family. And if we make it early healing, then we save a lot of money of the patient. Patient may not perceive it, but you perceive it. As a doctor, as a very good clinician, you perceive it, how much help you have given to the patient. And as I discussed, there are no dedicated centers, lack of team approach, late diagnosis, and the main thing where Elegance Diabetic Foot and Ulcer Clinic stands and why it is successful, that's systemic inertia. Healthcare system is remaining managing wounds with dressings, with various kind of materials, with various kind of growth factors, new dressing. The dressing cost itself is 1000 rupees. But none of them is talking about why that ulcer has happened. So if we treat the root cause, then ulcer will automatically heal. And that's the speciality of Elegance Diabetic Foot and Ulcer Clinic. So I always tell my patients, if you have malaria and you have a fever, fever is the symptom of your disease. Here, ulcer is a symptom of your diabetic foot condition. If you are treating ulcer only, you are not going to treat your anyway and it will recur. But if you treat the cause of ulcer, you will surely be in success. So we started our clinic due to an incident where one patient of diabetic foot came to us. We tried our best but we couldn't, and we need to amputate that case. And then we thought, could we have done something early? And that was the trigger point. We started and we thought that mission that no more preventable amputations. And that's how we started our journey with very small clinic. You can see that very basic department is there, and now we have reached here. You all are invited to see that place if you are here. But treated with the process, you cannot make out that amputation is done. So we don't only save limbs, we save their mobility, we save their independence, we save their earning capacity and livelihood. We also save their family's hope, we save their self-image and personality. If I ask what amputation can do to a person, I'll just say what it can do. First is loss of independence. Even toileting, bathing, dressing, you have to be dependent on someone. It reduces mobility. So your muscle wasting is there, joint stiffness is there, and all elderly patients are affected by this. Increased mortality rate. 50% of them who has been amputated on one side will die within 3 to 5 years. And this is again a proven published journal data, medical journal data. So amputation is not just a loss of limb, it's a life-threatening event. So like cancers we talk about 3-year survival rate, 5-year survival rate. Here also it's there. Psychological impact, अभी मैं किसी काम का नहीं रहा हूँ, डिप्रेशन, मैं परिवार पे बोझ बन गया हूँ. Financial burden. You see, if you feed the processes, it's not for lifetime. You need to repair it, change it, new ulcers. Family members become full-time caregivers. They have risk of second amputation also. So saving one foot today is saving both legs tomorrow. Poor wound healing can happen, stump infection can happen, and rehospitalization is there. Reduced quality of life. They lost their hobbies, they lost their social life, travel, everything. So overall life satisfaction drastically drops. Increased risk of bedridden status. And so, in elderly diabetic patients, amputation is not just a removal of limb. It is often the beginning of the loss of their independence, dignity, and sometimes life itself. To create our vision, to create a world where no limb is lost to diabetes due to lack of awareness, lack of access, and timely care. This is by building India's most trusted network for diabetic foot prevention, treatment, and limb salvage. Our mission is to save limbs and save lives, standardize, deliver the world-class evidence-based diabetic foot management, and for that we have created lot many SOPs, lot many manuals, lot many algorithms, and that can be directly transferred to those who can be interested with us. It's a multidisciplinary, means vascular surgeon, plastic surgeon, orthopedic, those all can be made together. Educating and empowering patients, family, and mainly doctors, also for early intervention and lifelong foot care. Ensure affordability. The main problem here is affordability. In diabetic food patients, you know, they are all poor. So we need to take care of that also. And our philosophy is we don't treat just wounds, we treat the cause. Limb salvage is a responsibility, not the choice. Time is issue. Early intervention makes the difference. And we also believe that team over the individual. So no single doctor, we have to be working as a team. Patient first, always with compassion and competence. So we do this, we are continuing for last 5 to 10 years we are doing this awareness activities. As Neeraj mentioned, this is a Diet Food Summit where we have gathered more than 115 delegates all over India, some of them from even Nepal and Bangladesh. We have more than 30 faculties for that, where we have given the basic diabetic food training to all those who want to do it. It was 3 days long program. These are various camps organized at our clinic. We call elderly people and make them aware about diabetic food. Various medical fairs and networks like BNI also we work there to spread awareness. Various temples and societies also we do lots of awareness activities. And how are we different than others? You see that there's a integrated EDFC model where everything is under one roof. You can get consultation, you can get surgery, you can get your footwear, you can get expert opinion, everything under one care. Main thing is we work on 3 main categories, like preventive, those who have diabetes but no ulcers, we take care of their feet also, as well as we provide them protective footwear. Then curative, you have ulcer, we treat them. So we go to the root of the cause and we treat that ulcer, and the ulcer will not recur for almost lifetime or maybe 5 to 10 years. We also do lots of surgeries, biomechanic surgeries, which are done only in 10 to 15 centers of India. We are doing it in Surat for last 5 to 10 years. And the last part is rehabilitation. For that, we have prosthetists with us, orthotics with us. They provide proper footwear. Those who are amputated, we give them proper prosthesis and training. We have physiotherapists, we have dietitian. So we treat patient as a whole. We don't just treat the ulcer. So basically care on traditional approach is just dressing based treatment, while we treat the root cause. Instead of single doctor, we have a multidisciplinary team. Instead of late intervention, we do early screening and find out where the things are going wrong. We have continuous monitoring system, and we have others have 60% limb salvage, but we have 90% limb salvage. Today evening, we have called our old patients. We are making a good get together for them with one play for awareness, and also there will be good musical evening and dinner for them. Those who are in Surat want to join us, they can come at Jeevan Bharati Rotary Hall at 3:30 p.m. So we will be screening them, we will be educating them, there will be a play also, and then there is a musical evening and dinner. So it's a continuous process to educate society where diabetic food is not talked about. So prevention, then active treatment and rehabilitation. You cannot leave patient once that ulcer is healed. Diabetes is a progressive disease. Diabetic food is a progressive problem. So once ulcer healed, still your care must be going on. We have various advanced healing tools, various biomechanical solutions also. And this is our team, where I work as a founder and chief surgeon. Dr. Chintan is my associate head. We have two associate doctors for specially diabetic food. These are our clinic manager and public relations. We have dermatologists also, physiotherapists, dietitian, anesthesiologist. On panel we have vascular surgeons, orthopedic foot and ankle surgeons, endocrinologists. We have our own wound care dressing team also, and we do have home care. Those patients which are elderly and not come to the clinic for daily dressing or maybe alternate day dressing, or there is no one to take them to the clinic, we send our trained boys to their home and do the regular dressing also. And this is whole our Elegance team. We have more than 45 to 50. We have advanced instruments all about which are required for the early diagnosis and the treatment of the early cases. This is neuro ABI to find out any vascular problem you have before it causes gangrene. So it measures the blood pressure difference between your arm and legs. This is biofaciometer where we check their sensation, and we always advise all diabetic foot patients to come there for diabetic foot health checkup. We all go to bigger hospital for medical health checkup where they measure the blood test and everything. But no one is doing diabetic healthcare checkup, diabetic foot healthcare checkup. So that is available at Elegance Diabetic Foot and Ulcer Clinic. These are LED therapies for neuropathy. You know that they have burning sensation in their feet. They have neuropathy. So this infrared and LED based therapy will cause burning pain to reduce and nerve to recover. This patient needs to take some time, so then now pain will go away. This is topical oxygen or ozone therapy, where the wound is not healing due to improper perfusion and less of oxygen. You can increase the local oxygen with this therapy, and so that the wounds will heal faster. And there is ozone also. That ozone will, you know that ozone is protective and it will kill the bacteria. So these therapies are also available at us. And it increases the oxygen saturation at tissue level. Audiodoppler to find out vascularity of your limbs. With this you can find out whether the vessels are present or not in diabetic foot. So arterial flow is the main thing for any kind of healing. If the blood flow is not there, you cannot be successful. These are Harris plate, and the next coming up is the computerized plate, where patient will walk, and after walking it will take an impression that where abnormal pressure is coming, and that abnormal pressure will cause ulcer formation. This is neuroimpulse to improve the neuropathy. So any kind of weakness in limb, pain, tingling can be taken care of this. We also do surgeries for nerve release, those who have burning pain. C-arm and everything for operation theatres, for orthopedic procedures. It provides the real-time X-ray images during operations. So real-time confirmation. We need to remove the bone infection, what we tell it osteomyelitis. So while removing the infection, we need to remove bones also sometimes. Digital X-ray is also there, so that patient need not to move all around. Immediate diagnosis will be done on weight-bearing X-ray. This is CBT machine as well as the patient. This is Elegance Diabetic Foot and Ulcer Clinic. So we only do not treat diabetic foot, we treat any kind of ulcer in the limb. Means we treat lymphedema, we treat varicose ulcer, we treat varicose veins, we treat hypertensive ulcers, and post-trauma ulcers. So any kind of ulcer will be treated at Elegance Diabetic Foot and Ulcer. Again a neuroscan to check your vibration sense and your touch sense. So whether you are developing neuropathy or not, that will be taken care. And as early you know, you can be on protective footwear and protective therapy. And this is pedobarogram or podogram, where patient needs to walk on this and we will get an image of abnormal pressure, and depending on that we decide the which surgeries to be done on patient so that ulcer will not recur again. So this is helpful. As you know, this all red color is highest pressure and the pink is the highest pressure. Depending on that we make diagnosis and we need to treat the patient. This is again a glucose stimulation device to help the neuropathy and neuromuscular weaknesses. It improves the blood circulation. We do provide footwear, offloading devices, prosthesis, AKBK, and cosmetic prosthesis also. So this is totally healed ulcer, and guess what time we have healed it? Usually it takes around 6 to 7 months with various kind of footwear, but this is just 21 days. This ulcer was 3 years long ulcer, healed within again 21 days. So we are saving limbs, we are restoring hope. Join us in the journey of from wounds to wellness. Thank you very much.
थैंक यू सो मच आशुतोष सर. सो फर्स्ट ऑफ ऑल आशुतोष सर ने अपना एक मिशन बना लिया है डायबिटीज पेशेंट्स के पैरों को बचाने का. बट शायद हमारी जितनी आज के दिन जनता है और जितनी बड़ी प्रॉब्लम है, एक आशुतोष सर शायद सफिशिएंट नहीं होंगे उन सबको टैकल करने के लिए. तो हमें ऐसे 100 आशुतोष सर खड़े करने हैं जो अपने अपने एरिया के अंदर, अपने अपने जियोग्राफिकल एरिया के अंदर उस चीज को बड़ा कर सकें, उस वहां के लोगों को उस चीज से रिलीफ दिला सके जो प्रॉब्लम सर ने आज हमें एजुकेट किया और बताया है. शादी के टाइम पे सर को 5000 रुपीज दिए, मेरे को याद है वो 500 के 10 नोट. और उस समय उनकी मदर रो रही थी और उन्होंने सर को बोला कि अपने सर स्टाफ में प्लीज ये डिस्ट्रीब्यूट कर देना. और फिर वो चले गए और सर उसके बाद में बहुत ज्यादा इमोशनल हो गए. तो मैंने पूछा सर क्या हुआ, तो सर ने मुझे बताया कि इनका बेटा है जो अराउंड 30 साल का है और मुंबई के एक बहुत बड़े हॉस्पिटल में, जहाँ पे उनको बोल दिया गया था इनके पैर नहीं बच पाएंगे और उनको कट करना पड़ेगा, वो हमारे पास में आया सूरत में और विद इन 3 मंथ्स हम लोगों ने उसको 100% रिकवर कर लिया. सो दिस इज अ स्टोरी जहाँ से मैंने इस चीज का इम्पोर्टेंस समझा कि ये चीज कितनी बड़ी जरूरी है. और साथ में आज के कलयुग में एक चीज ये भी इम्पोर्टेंट है कि बिना खाए भजन भी नहीं होते. तो ये तो हम एक बहुत सोशल कोर्स करने जा रहे हैं. इस कोर्स में 100 आशुतोष सर खड़े करने के लिए हर एक के लिए अपना एक मोटिवेशन भी होना चाहिए. तो हम इसको एज ए बिजनेस की तरह किस तरह ग्रो कर सकते हैं, उसके लिए हमारे जो बिजनेस पार्टनर है, फ्रेंचाइजी मैनेजर है मिस्टर दिनल भाई, मैं उनको इनवाइट करूंगा कि वो आगे हमें समझाए कि इसके अंदर इस इतने बड़े इंपॉर्टेंट कोर्स में कैसे ईडीएफ से हेल्प कर सकता है. और जो भी लोग हमारे नेक्स्ट डॉक्टर्स बनेंगे, ज्वाइन करेंगे, उनको इससे क्या बेनिफिट होगा और किस तरह से वो आगे कंटिन्यू कर सकते हैं. ओवर टू यू सर.
यस, गुड मॉर्निंग. इसमें से कितने लोग मेडिकल प्रोफेशन से और कितने लोग नॉन मेडिकल प्रोफेशन से? नॉन मेडिकल वाले कितने हैं? चलो ग्रेट. सो मीन्स इट्स अ कॉम्बिनेशन ऑफ बिजनेस एंड डॉक्टर्स. अभी एक ऐसा तो है कि हेल्थ इज वेल्थ, हेल्थ भी है और वेल्थ भी है, राइट? सो देयर इज एन अपॉर्चुनिटी फॉर बोथ. नाउ सी एवरी business starts with a problem. Probably 15-20 years back दो लोग रोड पे खड़े थे और सोच रहे थे यार गाड़ी बुक नहीं हो रही है, कैसे करेंगे? So Uber started. One man was facing to order a food कि ऑफिस में खाना मंगवाने की हर रोज की तकलीफ है. Zomato started, right? So any business where there is a problem, there is a business. Okay. We are here to talk about more of a business. So EDFC, Elegance, Diabetic, Foot Care and Ulcer Clinic. That's a basically मैं आपको पूरी opportunity समझाने आया हूँ. So those who are from the medical field also and non-medical field, दोनों के लिए ये opportunity available है. Now as sir already told that कि इतना बड़ा market है, around 14 crores, यानी हम पकड़ते हैं इतने lakhs हो गए, which is a market. शायद हम में से भी अगर मैं किसी को सवाल पूछूं कि क्या आपके घर में किसी को डायबिटीज है, तो प्रोबेबली कहीं ना कहीं तो किसी ना घर पे एक तो होगा, राइट? सो दैट्स द थॉट बिहाइंड इट. नाउ इफ देयर इज अ सोशल कॉज, बट उसको स्केल करने के लिए भी, एक मिशन में जुड़ने के लिए भी एक ऐसा मॉडल बनाना पड़ता है कि इट कैन स्केल वेरी फास्ट. अदरवाइज क्या होगा कि वी कैन नॉट रीच दैट एज अ पॉपुलेशन इज आल्सो इंक्रीजिंग, डिमांड इज ऑल्सो इंक्रीजिंग, तो उसको रीच करने के लिए भी हमको बहुत बड़ी टीम लगेगी. नाउ एज अ ओनली EDFC वी कैन नॉट स्केल दैट लेवल, सो वी जस्ट वांट टू स्टार्ट फास्टर. और हमने ऑलरेडी स्टार्ट कर लिया बिकॉज वी हैव द सिंस द डे वी लॉन्च वी हैव ऑलरेडी गिवन आवर फर्स्ट फ्रेंचाइज एट वाइजैक नगरम, दैट इज नियर वाइजैक. सो दैट्स ऑलरेडी इन प्रोसेस, अग्रीमेंट्स आर साइंड, लोकेशन इज फाइनलाइज्ड. Even interior works is going on. So probably within 1 month or 45 days, we'll be launching that center soon. So this is how it goes. Now, इसको हम numbers तो आपने सर ने बताया, still I'll evaluate more. So एक सबसे पहला सवाल यहाँ पे जो भी आए, पहले मैं पूछता हूँ फ्रेंचाइजी फेल क्यों होती है? Let's focus on that. Because anybody who wants to invest बोलेगा सर फ्रेंचाइजी तो बंद हो जाती है. So better is why a franchisee fails. तो पहले इस पे ही हम डिस्कस करते हैं. Anyone want to talk? कोई फ्रेंचाइजी लिया हुआ है, any experience? फिर बोलेंगे वो MBA चाय वाला तो सर खुला था, बंद हो गया फटाफट.
Brand support. Brand doesn't support them.
Yes sir.
जैसे it's from medical field.
लेकिन
कहीं जैसे आपने कहा MBA चाय वाला, वहाँ से उनका सपोर्ट नहीं होता है या कॉस्ट बहुत ज़्यादा हो जाता है, ठीक है? तो बेसिकली ये बेसिक रीजन.
सर yes sir, continue.
Yeah.
So that's right. So support. Anything else sir? See now there are two things. See ऐसा maybe we have thought of that support is a problem. Yes, it is a problem. But it is never intentionally done. Technically आज कोई भी ब्रांड होगा बनाएगा, ब्रांड ओनर इतना प्यार से, तो उसको बंद करने के लिए क्यों बनाएगा, right? But the thought behind is this: the idea has to be first captured into a system. That's the first aspect. वो सिस्टम इतनी इजी होनी चाहिए कि कोई भी लोग, whether it is a medical or non-medical, should able to use it very smoothly. वरना वो सपोर्ट ही है. सिस्टम इज बेसिकली सपोर्ट. अभी सर का जो ब्रेन था 20 ईयर से उन्होंने इतने किए, 10,000 पेशेंट्स वी हैव ट्रीटेड. वी हैव टू गेट इट डॉक्यूमेंटेड, वी हैव टू मेक इट इन अ सिस्टम्स. दैट सिस्टम विल हेल्प अस टू स्केल. नाइदर सर इज एन ओमनीप्रेजेंट, ही कैन बी लाइक एवरीवेयर, दैट्स वेरी डिफिकल्ट. नाइदर वी कैन क्रिएट दैट काइंड ऑफ बिगर टीम दैट सब लोग वही लेवल से करेंगे. सो वी हैव टू फर्स्ट डेवलप द system. That was the whole logic when we started. So when we started with the Surat Diabetic, we started with 2 centers that were Adajan and Veshu. We experimented everything, we piloted everything, we documented everything. First thing is that कि ये पेशेंट आया तो क्यों, तो इतने सारे वीडियोस आपको दिखाए, बट प्रोबेबली वी हैव अ फुल हार्ड ड्राइव ऑफ वीडियोस So that's the brain what sir has. We have tried to put it into a system. So fail क्यों होती है without systems? That first. No escalation path. Yes, आज मैं बोल सकता हूँ कि maybe many food brands fail because of improper logistic support. होगा ही नहीं, यहाँ खोल रहा है गुजरात में और फिर बोलेगा सर महाराष्ट्र में मैं ओपन कर रहा हूँ, तो सपोर्ट नहीं दे पाएगा लॉजिस्टिक सपोर्ट. But so there is a no escalation path. So they keep opening everywhere without a clarity that this city or this state has to have a potential of that, right? And last is high market competition. Probably we as an EDFC, we are the first mover advantage in this business model, right? So we have captured all these things. So we started working on this since last 2 years. We keep getting all these things in place. So first was our job was to make everything into the systems. Second, we have a clear-cut roadmap where to open a center, how much center size has to be open, and when to open. फिर ऐसा नहीं कि अडाजन में खोल दिया, अडाजन के एंड पे आके आनंद महल रोड पे दूसरा खोल दिया और फिर आनंद महल रोड पे आके LP सवानी रोड पे तीसरा खोल दिया, right? We will not do that. Okay, so there has to be a defined goal. कि this many our centers would be required in Surat, this many required in Ahmedabad, these are many are required in Mumbai. So we have defined business plan for that first. So we have an entire clear-cut path where we are going it, and yes, market potential. I think we are already sir have said. So it's the second highest globally. Yes, as a population we are highest, so definitely this also we have to be highest, right? सबसे मीठा तो हम ही खाते हैं, right? So that is also a advantage, disadvantage आप समझ लीजिए. Now 19.20. These are the people who lose have a food complications. This is growing at a 15% annually. Okay, so that's another aspect of it. There is no organized franchisee business available for this. So there is no organized business opportunity at this stage. So as already sir said, we have treated 1 lakh leg amputations, which is already there every year in India. 50% face and second amputation within 2 years. 80% caused by diabetic foot ulcers. And 85% of amputations are preventable. So I think sir has already explained very well in all these things. I will not go into this. We treated 10,000 plus, we surgical interventions of 5,000 plus, and our success ratio is more than 90%. Now we saw every gap, we built an answer for each. So every protocol documented, every process systemized, every tool integrated. So best I can say it's an EDFC franchisee operating system, or we say OS. Okay, like जैसे Microsoft का OS होता है, Apple का iOS होता है, ऐसे हमारा खुद का भी एक operating systems है. So we have designed a stages. So if this problem comes, this is what you have to do. If this problem comes, this is what you have to do. So these are all system driven problems which are being solved. Second thing is we have another, so I said it's a clinical system where we built it. Operational systems that we will already hand it over to all our franchisee partners. Technology infrastructures, I think sir has already shown all the instruments which we are going to use it. And escalation structure. So now if system cannot solve that problem, then there is our physical team of doctors which already has been we have presented, and then above that sir is there. So final, if any complications are, this availability is available. So this is how we have created the entire ecosystem for franchise. Now we knew the launch phase is where most franchisees break. So see what happens. First and the foremost is training. पैसा ले लेते हैं फिर फोन नहीं उठाते, that's very common. But we will first give you training. Any medical professions who wants to take this franchisee, so he will be having a 2 to 3 weeks of intensive training program under the sir. Currently also we run a training programs, so that will be a part first. Second thing is site selection. So our team will come down there, we will see the site, whether we have a visibility or not, whether it suffices all our requirements or not. If not, we will say no, we will look out for another location. Then comes, we have all equipments and vendors in place. So there is a system framework ready. So you just have to put a list, we'll give it to you, and we will help you to completely source those. Inventory setup, so interior part is also be there, or all inventory products are also be there. Second thing is, most important is staff hiring. So we have our own team which will help you to hire the staff. So that staff will be getting trained and we will hand it over to you. SOP handover, because once the training is done, then and then we can have an SOP in place. Important is license and regulatory, as most of the medical professions will be knowing it, but still we'll guide them which licenses are required, which are not required. And last and the most important is launch marketing. See, सोच तो लिया कि भाई अहमदाबाद में खोल देंगे, जगह भी देख लिया, सब कुछ हो गया, but there has to be a perfect launch plan. Apple का फोन लॉन्च होता है, तो there is a launch event, okay? If the BMW launches a car, there is a launch event of a car. Same way, if we will have our own proprietary launch event where we will be inviting the people who are there, we will be having our own camps, we will be having a doctors in place who can refer us. So that is a whole launch marketing plan which we have developed. So second thing, once we have an opening, then there is a need of an audit. So from our team, it will be an audit quarterly. Technical support, yes, whatever the support is required on the technical side, we will be giving it. Supply chain access, so any raw material, we have a system like a cart where you can order it and it will be delivered. And marketing and digital presence, which is most important. So as far as marketing is concerned, mainly the business, today also we generate is digital. You saw the testimonial that he said, I see the ads and I came there. तो ये बेसिक है कि हमको भी वही करना पड़ेगा. तो वी हैव लॉट मेनी टेस्टिमोनियल्स. वही टेस्टिमोनियल से हम शायद आज सूरत में ओपन कर रहे हैं, तो अहमदाबाद में वही टेस्टिमोनियल होगा, पेन पॉइंट वही होगा. वी विल रन दोज एड्स एंड वी विल गेट दोज लीड्स आल्सो. सो एंटायर सोशल मीडिया एंड बैक एंड टीम वुड बी सपोर्टेड बाय अस. Second thing, we already have an advisory board on place. We have plastic surgeons on place. We have medical officers on place. Social media team on place. So everything is in-house. We have not outsourced anything. Everything is in-house, so that we can support all our partners who are joining us and who has trusted us. Now, why right now? As I already said, it's a first mover advantage. So that's first aspect. Own your patients base. So it's like opening in one city. You own a base, that's the first point. Market as a potential, it is growing at a 15% every year on year. So diabetic as a disease is spreading at 15% every year. So that's the potential. Now, see, coming to the franchisee part, we have divided our business model into two aspects. So one is for a medical profession and one is for a non-medical professions. So anybody who just want to be an investor in the company, our center, so we will be managing the entire show. And somebody who just want as a medical profession that I want to be a part of this journey, as Neeraj said that we want more 100 Ashutosh Shahs, so that he comes under the franchisee owned, franchisee operated model. So these are the two models. I'll explain you in a detail. So first thing is investment for a franchisee owned, franchisee operated. This is the entire total investment. It comes around 34 to 50 lakhs because we need around 800 to 1000 square feet. So these are all on actual. So once we see the location, our team will give you entire breakup of the cost, and it has to be occurred that way, because many a time there is a different cost of a signage, there is a different cost of air conditioning. It may vary, so we have written this range. Our franchisee fee is one time 7 lakhs plus GST, so it's for 9 years. Area required is 800 to 1000. Location type, we look for a residential or medical hub, and the royalty is 8% or gross revenue. So what you get, 100% 2 to 3 weeks clinical training program, complete OS, what is operating system we call it, entire all the supports which I have mentioned. So staff training, quarterly cleaning, clinical audits, marketing and digital launch support, and centralized supply chain access. So this is what somebody who is from the medical profession gets as a EDFC franchisee opportunity. Second thing, there is an investor model which is very simple. You have to just park the money, rest everything is on us. We take the responsibility to run it. So very simple as that. Your investment comes in the range of 70 to 90 lakhs. The reason is we may see the opportunity today if you say, but the investment we may go to Mumbai also, or we may take that investment to Pune also. That's a company's decision where we will park that money. More the potential we will see that city, we will park that money. So it ranges from 70 to 90 lakhs. Our franchising fee is 10 lakhs. What we give is minimum 1% per month on the investment, not on the franchisee fee. So if you have invested 70 lakhs, so then it would be 1% per month and a revenue share of around 8%. So this is how depends on the area to area and city to city, right? So exit option, normally we have made it that the day we get your revenue double, investment double, you can exit or you can continue with a lesser revenue share. मीन्स मैं आपको समझा देता हूँ, 1% आपको आपके इन्वेस्टमेंट पे मिल जाएगा, राइट? 1% इज व्हाट आई एम गोइंग टू गिव यू ऑन योर इन्वेस्टमेंट. 8% मैं आपको रेवेन्यू शेयर दूंगा, जो भी सेल्स आया उसका. द डे डबल हो जाता है तो ये सब मिनिमम बंद हो जाता है. देयर विल बी अ रेवेन्यू शेयर विच विल कंटिन्यू. तो ये बेसिक हो गया. देयर इज नो इन्वॉल्वमेंट ऑफ योर्स, 100% ऑपरेटेड बाय कंपनी. सो there is no liability on your head. We will see the potential and we will open this. The opportunity is clear. Clinical proof exists because we already have done a pilot at 2 places. System is built. 20 years of expertise compared to fully operational systems ready to scale from day one. Outcome documented, validated across 2 operational centers. Not a concept, a proven franchisee ready business. So thank you. If you have any questions related to business, I will be happy to answer.
So as an investor, we just need to invest in. So everything will be taken care of by with your team.
Yes, sir, 100%.
That's okay. So 1%, as you are saying, that will be the guaranteed amount. Apart from that, we will be sharing 8% on gross or on net.
Gross.
Gross. Okay. And this term will be for
9 years.
9 years. Okay.
So, but sir,
that
what
is
happens?
to be extended.
Yes, sir. But what happens, sir, when your money gets doubled? We will stop this minimum guarantee because we have already doubled your money.
Okay.
So I have to reduce this revenue share and we will make it a sum which is it becomes like a continuous income for you. Because
Okay.
otherwise, as a company, we will not be profitable. But at that stage, we will come to you again that sir, we have another opportunity to open second center in Bangalore or maybe Mumbai. And definitely, if you have doubled the money, you will be the first person to be joining us.
Hello.
Yes, sir.
I am a retired doctor or surgeon from a medical college. Now, if I really want to get into this, the investment purpose might not be so much visible to me because I was a government servant for so many years. But in that case, how this company can help me out to utilize my skills as a surgeon.
Okay, sir. Definitely, sir. We will have. We can use your knowledge and expertise, but for that we have to discuss with our board members. We already have an advisory board in place, and we need to evaluate what is your expertise because at this call I cannot evaluate the expertise. But definitely, if you have that expertise and you can add value in the system, you are most welcome to the team, sir. We will be more than happy to do that, sir.
Another thing is that for not less than 35 years, I am with Lions International. And they do have a very prime project of diabetic care per se. For not less than 10 plus years, I am the chairman for this particular portfolio. And we used to do a lot of care for the diabetic patient. Very less for the complications, but more for the
Basics.
Diagnosis and
Primary levels.
So, perhaps such type of NGOs, how they can be amalgamated with such type of thing. That is one thing. Because every year there is to be change in the whole team, and the newer person comes for such type of portfolio. And then if we can have some sort of link with such NGOs, they are having a lot of projects and a lot of funding with them.
Definitely, sir. We can discuss and we can sit over and we can see the opportunities. 110%, sir. So post this meeting, we can discuss it out. Any questions related to from medical, non-medical backgrounds?
Excuse me, one more question. Is this for diabetic foot only or diabetes center as well? Is those who are having diabetes, they too will approach or only for diabetes?
Sir, diabetic foot and ulcer, sir.
And
This
this
is
is important.
Good afternoon, sir. I want to ask that this therapy will help in if leg is not I am non-biotic and my leg is crossed, so it will help or not?
I'll ask.
Can you please repeat the question?
Yes. I am not a diabetic, sir, but my leg is like running cross. If you can see my shoes, it will be like rubbed from one side. Okay, so is this therapy help for that or only for diabetic? Context to the same question asked to ask sir.
Yes. So this is any basic food problems.
Yes.
So maybe it will be flat foot.
Yeah.
Can it be cross leg? It can be the equinus. Where any foot deformities will be taken care of, but not the general diabetic, sugar control, and all will not. Any food problem will be taken care of.
Okay. Okay.
Any food problem and any ulcer. So anything specific to food, but the main basic weightage is not diabetic food, but anything related to food will be taken care of.
May I ask you that if not this therapy, okay, and my foot is like this, okay, it's of course like this, so it will be curable by without therapy or any way. If I change shoes pattern, walking pattern, or anything.
So basically what we do is we do your pliobarogram, computerized testing while walking where the pressure is coming. And
Okay.
depending on that, we create a different kind of shoes for you,
Yeah.
where the insoles will be modified for you, and then we have ties with 2-3 orthotics or prosthetics. They will make a specialized insole for you. So any normal footwear, but you can have your specialized insole, and then the deformity will be corrected. But if you want the deformity is corrected permanently, then you need to undergo some surgery or maybe some procedure.
Actually, I have tried whatever you are telling that Sol wala thing. I have already tried, but it won't create much help. I have
Then
tried
you
for
can come to
two.
us, we'll assess the
Sure,
things.
sure.
Sometimes the tendons are lax, sometimes the joint capsule is lax.
Yes.
So whatever is your problem, we can finally discuss and we can find out the solution.
Sure.
And in that, we may require the teamwork from the orthopedic side also.
Yes, yes. Oh, absolutely. Thank you so much.
She's a diabetic, and many times when we travel on long journeys, so her legs they are swollen up, and she's having a lot of pain for at least 4 or 5 days. And even when she walks for more than half or 1 hour, she's having the same problem of swelling. Is it related to the same thing, diabetic foot?
Yes. One thing what you told about is, you can sit here. One thing, first thing you told about was the swelling on the limbs when they are getting dependent. So it's called dependent edema. So your fluid is not going up. Okay, normally our fluid goes up normally. But here when it's a dependent for a long time, in car or maybe in plane, you will get this type of edema. Even normal person can get that. But for that you can have a pressure garment. Usually there are garments available. You wear that stockings and that this is taken care of. But if your wife is diabetic, take care of her kidneys. If there is a renal problem, then also they will get this type of swelling.
Diabetes should is 354.
Yes, so that's the reason. So she may be having a problem with her kidneys or maybe the heart. So pumping of heart is less, then this type of edema is seen. And if it is bilateral, then it means that there is a systemic problem. So it can be simple dependent edema also. If we go to America and after 18 hours, we can also get the edema. But if your wife is diabetic for a prolonged time, get a check of their heart and kidneys also. The second thing you asked was, sorry, what was the second thing?
Means whenever she walks,
Yeah.
after half an hour, 1 hour,
Yeah, so
again,
it's called claudication pain. Means you walk and then there is an extra supply of blood is required. And due to diabetes and calcium inside your blood vessels are non-elastic. So they are not able to provide you more blood. And then this type of lactic acid will gather in your muscle and it will cause pain. And you stop, you rest for some time and you can again walk. So it is showing that there will be some vasculopathy, some vessel problem. That's an initial problem. It starts like this and then progress to gangrene. So gangrene is the end stage. So you maybe, if you treat her now with angioplasty with vascular surgery, then now like heart we do angioplasty in limbs also. So you can get a fresh blood supply and this problem will be solved. So this kind of things people miss and they turn up with gangrene only. So our aim is to find out people with screening at this level only.
so we can consult you for that.
Sure,
Thank
thank
you.
you.
Thank you.
Thank you, sir. Any questions? So there is one more number I will be talking. See, we from our past data, we normally look around 60 to 70 patient easily. That's on a monthly basis what we see. And our average value of spending, what I'm trying to say is a number, that's average person spends around 25,000 to 30,000 rupees. So you can easily calculate the ROI. You all are well and experienced businessmen and doctors. So that's how the ROI is calculated in our terms, because our cost as an operational expenditure are less, but yes, capex is quite high. But as a potential easily means I'm just talking about 2 patients a day. That's very easily viable in this terms. If you take a CT like a SUR, 2 patients a day, it's very easily viable, right? So that's the opportunity what I'm trying to explain, because we have a data from all the 2 centers. Probably our numbers are quite high, but we started with this minimum numbers.
टू अंडरस्टैंड कि ये कैसे एक बिजनेस भी बन सकता है अदर देन ए सोशल कोज. सो आई रिक्वेस्ट एवरीवन कि जिनके भी कोई क्वेरीज है रिलेटेड टू फ्रेंचाइजी, वो दीनल भाई उनकी टीम यहीं पे है. जिनके कोई भी क्वेरीज है रिलेटेड टू मेडिकल, इसके अंदर कैसे ये चीज़ मल्टीप्लिकेशन में आएगा, वहाँ के डॉक्टर्स को कैसे ट्रेन किया जाएगा. सो आशुतोष सर इज ऑल्सो विद अस एंड आई रिक्वेस्ट एवरीवन कि आप हम सबको ज्वाइन करिए लंच के ऊपर. और लंच करते करते हमारी सभी टीम के साथ में, ईडीएफसी टीम के साथ में हम इंटरेक्शन करते हैं. और जिनकी भी इंक्वायरीज है रिलेटेड टू ईडीएफसी फ्रेंचाइजी, जो भी इंटरेस्टेड है, हमारी टीम आपसे एक बार बात करेगी और उसके बाद में आप हमें वहाँ पे अपना इंटरेस्ट शो कर सकते हैं. थैंक यू सो मच सर. प्लीज़.